Are you or a loved one suffering from depression or anxiety or another mental health condition? Has your doctor recommended you take Zoloft or the generic version Sertraline? Are you concerned about possible side effects? If so, then this is the video for you. Keep watching to learn a little more about what to watch out for and how this medication may be a help to you. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is a channel that focuses on bringing better health to your home. On today's episode, we're going to be going over a common antidepressant named Sertraline, or more commonly referred to as Zoloft. Sertraline is a generic version of Zoloft, which has been around in the United States since 1991. Zoloft is a medication that is used most commonly to treat clinical depression and anxiety. But it's also commonly used to treat conditions such as obsessive-compulsive disorder, PTSD, and severe PMS. It's a class of medications that we call SSRIs, or selective serotonin reuptake inhibitors. These are a group of medications that target the hormone serotonin and help decrease how rapidly it is broken down in the nerves, thus keeping your serotonin levels higher. It's one of the vital chemicals, or neurotransmitters, that help regulate a lot of the functions of the body like mood, social behavior, appetite, digestion, sleep, memory, among other things. It's one of the chemicals that plays a big role in depression and anxiety and your overall mental health. Now, when you're suffering from depression or anxiety, or the other conditions that I mentioned earlier, in addition to things like eating healthy and exercise, counseling and therapy, and getting plenty of sleep, targeting these chemicals in the brain has been found to be very helpful in allowing people to resume a normal life when they're battling with these conditions. You don't have to live with these conditions controlling your life. Go see your doctor so you can get an accurate diagnosis and figure out a good treatment plan for you. Remember, depression, anxiety, PTSD, OCD, and any other mental health disease are as real of a medical condition as diabetes or high blood pressure. And you shouldn't feel any different about treating these conditions than you would any other disease. Okay, so you've talked to your doctor and you both have decided that your symptoms, or for your symptoms, Zoloft is going to be part of your treatment plan. What should you expect? Well, first of all, it comes in a pill of doses of 25, 50, and 100 milligrams. The most common doses range from 50 milligrams to over 200 milligrams in some people. It's important to remember that this is the kind of medication that you need to take daily if you're going to be on it. Most people will start to notice some difference within 1 to 2 weeks, but it typically doesn't reach its full effect for 4 to 6 weeks. So you should be following up with your doctor within 2 to 4 weeks after starting it to report on how things are working. If you're going to be taking it, you want to make sure that you are not missing a lot of doses either. Doing so can really affect how well it's going to work and increase your risk of having side effects. Also, unless you're having some significant problems with the medication, especially after being on it for a few weeks, you don't want to stop this medication abruptly. After being on it for a while, your brain gets used to a certain level of the serotonin, and stopping it quickly will really throw you off and make you feel bad. Most doctors recommend that if the medication is working well, you take it for at least 6 months before you think about stopping it. Stopping it sooner than that, because you feel like your depression or anxiety or other symptoms are gone, increases your risk for having your symptoms return. If you feel like it is something that is making a big difference in your life and you want to continue it longer than the 6 months, then it's safe to do so. I have patients that have decided that they just need to stay on it for years, and really that works for them. So what kind of side effects should you look out for? Well, as with any medication, you can find a big list of side effects that will be listed on the paperwork from your pharmacist. Sometimes these lists can be intimidating, but in the case of Zoloft, it really is generally well tolerated. I rarely have patients on it that want to stop due to significant side effects. However, any medication has a potential to having some side effects. Some common ones that are possible will be some things like headaches, nausea, tiredness, or difficulty sleeping, some dry mouth, constipation or diarrhea, heartburn, or even some abdominal pain. These type of symptoms tend to be short-lived in most people, and oftentimes, by modifying when you take it, or by taking it with food, you can improve or even avoid a lot of them. Usually with time, they start to get better on their own. One area, though, that does concern a lot of people is the effect that antidepressants can have on your intimate relations. This can be a known problem with most antidepressants, and certainly Zoloft can be one of them. It doesn't happen to everybody, but it's not uncommon. this probably is one of the more common reasons that patients will come back asking to try something different. If it is working for you for your other symptoms though, don't despair, because there are some things we can do to work with the problem. So don't stop it until you talk to your doctor if that is a concern. Now, probably the most common reason I have somebody stop this, or really any other antidepressant medication though, is that they just didn't like the way it made them feel. It may help with their depression or anxiety, so they don't feel sad anymore, but they don't feel happy either. And that certainly isn't the goal of this kind of treatment. Our goal is to help lift you up out of the hole you're in and help you see that life is doable again. If we turn you into a zombie and you're neither happy or sad, we aren't doing you any favors. We still want you to be happy when you're supposed to be happy and sad when you're supposed to be sad. So if you're noticing things like that, then talk to your doctor about other options that are out there. Now, there are some rare side effects that you need to pay attention a little more closely to. This is not an exhaustive list. However, it's important to know that at first, all antidepressant medications, including Sertraline, have the risk of making your symptoms worse at first. You may be feeling really sad right now, but if all of a sudden your depression or anxiety get worse, or you start having suicidal thoughts, you need to be in contact with your doctor and get help. I always recommend that when starting these kind of medications that you confide in somebody you trust and tell them that you're taking it. Let them know about these risks so they can help you recognize when it's happening and assist you in getting other help that you need. Other rare side effects can be certain heart arrhythmias, an increased risk of bleeding, electrolyte disturbances, liver problems, allergic reactions, and something called serotonin syndrome, where your body gets too much serotonin. This is very rare, but can present with symptoms like agitation, confusion, rapid heart rate and high blood pressure, dilated pupils, loss of muscle coordination or muscle rigidity, diarrhea and heavy sweating. If you think this is happening to you, get to your doctor or to the emergency room right away. Now, the worst part about discussing the side effects of medications is scaring you away from taking them. It's important to keep the perspective that the vast majority of people taking sertraline do really well with minimal to no side effects. So if you're deciding not to take a medication like this due to fear of having a very rare side effect, you could potentially be robbing yourself from an important tool in treating this disease. Remember, it's important to keep the perspective that if you're having a problem with a medication, you don't need to stay on it. There are a lot of other options out there, so get with your doctor and talk to them about your concerns. Depression, anxiety, and other mental health conditions can be very debilitating. They are as real as any other medical condition out there. When you have true clinical depression, taking something like Zoloft can be a life-altering step. I'm always amazed at what a significant difference this medication has had in the life of my patients. It's certainly not for everybody, and yes, there are other non-medication options that are out there that may work for you. If, however, you or your doctor feel that this is the best option for your treatment plan, you now have a good foundation and knowledge of what to expect and what kind of side effects to watch for. Having that information can be really powerful in your life. Now, this is not an all-inclusive discussion about Zoloft. My purpose in sharing this information is to help give you information that you can think about and discuss with your own doctor. It's not meant to give you direct medical advice in your own personal situation, so take this information and discuss it with your doctor. But overall, I hope you found this information to be helpful, especially in taking away some of the stigma that surrounds taking medication for mental health issues. To keep learning about other aspects of your health, check out my other videos. Specifically, to learn about whether another antidepressant named Lexapro is for you, click right here. To find out about simple ways to save a lot of money in your healthcare, go ahead and click right here. As well, go ahead and subscribe and let me know what you think about in the comments below. So until next time, this is Family Med with Dr. Richardson. And remember, take care of your body because it's the only one you have.